and welcome to 15 Minutes with Longevity. My name is Giselle Wertheim-Ames and I'll be your host. On this episode, we'll be speaking to Dr. David Presbury. He's a Johannesburg-based dermatologist, and we're going to be talking about scarring and how dermatologists might go about treating scarred skin. Thank you for joining me in the studio today.
Pleasure.
Dr. Presbury, in your practice, what type of scarring are you seeing and how are you dealing with that scarring?
Okay, well there's really sort of three kinds of scarring. There's the acne scarring, the sort of pitted scars that one sees all the time from seriously unpleasant acne afterwards. And then there's the sort of atrophic type scars, we would call them, like chickenpox scars, which are depressed. And then very commonly what we call hypertrophic scars. They're not true keloids, but they're the raised scars that you see, quite often on chests and backs, and they often come up after acne. They often arise from burn scars, particularly in black skins.
Okay. And are those scars relatively new, or are some of them very mature scars?
A lot of them are very old scars.
And can they be treated when they're very old?
Yes, I don't think it makes much difference, because a lot of the scars are old because the stuff that we're doing has only been available now, and a lot of the scars are very old. I mean, you get acne scarring in young people and we can treat that, but their parents have also often got it because they've had bad acne in the past, and you can treat both generations if you like.
So you talk about that's a relatively new phenomenon. So we're really talking about technology then that you're using to treat scarring. Should we talk a little bit about what that technology might be?
Okay, what they invented back in about 2004 in America were called fractional lasers. They're lasers that make defined little holes in the skin, which are infected wounds. And when you wound the skin, you make new collagen, and that will tighten skin. It doesn't replace facelifts, but it will tighten skin. And it's been found to be very effective for treating the acne scarring that you see on faces very frequently. And from that, they discovered that it also helped pigmentation, like women get after pregnancy, and the kind of pigmentation you get in dark skins after burn scars. And we started to treat the pigmentation, but we also treated some of those raised, thickened scars as well, and found that they just started to soften and become more mobile. And the first patient we treated was a nurse, and she had fallen in a fire, and when she was about 6 years old. And 36 years later, she had this huge band of scarring across her chin, and the pigmentation. So we started to treat the pigmentation. We ran the laser over the scars, and suddenly this scar that hadn't really moved for 30 years started to soften and flatten, and she found she could smile. First time in 30 years. And subsequently, we've done more of this scarring, and they soften and flatten. It doesn't mean all the scars go away, but it really, really helps mobility, particularly for facial scarring, where we've had people with burns who can't really move their mouths, who can now sort of eat an apple and this sort of thing. So
and I would think on other parts of the body as well, like motorbike accident victims, for example.
Scarring on the chest and back. It's always a process, and it's very slow. So they don't see much to start with. And then subsequent to that, the fractional lasers have been improved. And we have fractional carbon dioxide lasers now, which are a bit more, shall we just say, more powerful. But they also have been found to do this. Now, the other trick for treating scars is to inject cortisone into them, and they've known that helps forever. But it's pretty painful because you're stretching scar tissue. And again, it's very slow. So what we now do, instead of injecting them, because we're making little holes in the surface of the scar when we treat them with the fractional lasers, you rub the cortisone in afterwards, and it goes down the holes, and you can get that in, so we can do the combined treatment. And it's much kinder.
So listening to you, I get the sense too that we have to be realistic about treating certain types of scars. I mean, obviously very serious scarring is not going to go away with rubbing basic ointments or creams on it. You have to have some sort of medical intervention.
Yes, I mean, one's never sure about the creams because scars change with time. So I don't think it does any harm to rub creams in, but I don't think the expectations should be too hopeful, if you like. Scars don't have any sebaceous glands, they don't have any sweat ducts, so they do dry out badly, and you often see over the years eczema starting in old burn scars and things, and other scars in the winter in the high felt where it's very dry. So there's plenty of other reasons for putting creams on scars, but the expectation to fix them shouldn't be. But you know the kind of acne scarring that people get with the lumps on the chest and back? Over time, maybe 15 or 20 years, that may often soften and flatten itself, so scars do change. What you're trying to do is to get them into a much better place in an acceptable time frame.
And once we've completed those treatments, I'm assuming then that there is longevity in that you don't have to keep repeating that.
We haven't been at it for millions of years, but I don't think that there's any reason to suspect that they'll go back to where they were. And this all really comes out of treating, classical acne scarring, where you get these pitted scars. And you treat the patient with a fractional laser, maybe 4 or 5 times. Fractional means it treats about 25% of the skin, leaving you 75% in between, say, to heal it with. So it just goes red and swells for a day or two. Women can put their makeup on the same day. So it's very minimal downtime. It's very doable. But it takes about 4 weeks for the fibroblasts, the cells that make the new collagen, to kick in. But then they run for about 6 months. So you get the process going and do it 4 or 5 times in a 6-month period and sit back for 6 months. You can get superb changes. And you can do this in all coloured skins. It doesn't mess the pigment up, which is a real breakthrough, because things like dermabrasion that they used to do in the old days do mess the pigment up. And so you can tackle any skin type. And the downtime's minimal, but they were advised to use lots of moisturiser afterwards and keep out of the sun.
Yes, and probably,
which is quite difficult to do in South
Africa. And I would
Africa.
assume also using the correct, appropriate treatments for scarring.
Well, yeah, but I mean, it's not very complicated to use moisturisers and sunscreens and for women to put their makeup on. So it really is quite user-friendly, all of this stuff.
Great, thank you. And thanks very much for joining us in the studio today.
It's an absolute pleasure.
Thank you. Recently, we spoke to Dr. Gerd Gauglitz. He's a German dermatologist specialising in scar treatment and research. So let's take a good look.
Dr. Gauglitz is a clinical head at the Scar Clinic at the Department of Dermatology and Allergy at the Ludwig Maximilian University of Munich in Germany. We spoke to him via Skype after he recently presented a paper on the management of keloids and hypertrophic scars.
Scarring always has been important to manage. However, I think during the last years we had a bigger focus on scarring among patients, and that is mostly due to the fact that we, in general, I think, increasing aesthetic awareness during the last years. So scarring, I think, becomes a bigger concern for many patients, particularly as they know that slowly we have more possibilities in order to improve unpleasant scarring.
Scarring can have more than an aesthetic factor on a patient. If they do not heal or are left untreated, scars can create physiological problems. Dr. Gauglitz highlights the importance of proper treatment.
I think there are huge variations in between different types of scars. One is a fresh scar, which is normally characterized by a reddish color. It can be a little bit itchy, but then that can improve over time by itself. However, I think what you're talking about are these so-called excessive scars, which are also known as keloids or hypertrophic scars. And they actually can be a substance of severe pain, pruritus, but also, for example, when it comes to burn scars, a substance of severe contractures, for example.
There are several treatment options available for scarring these days, but choosing the right one can be daunting.
It's a difficult topic, particularly as the scar market is increasing tremendously. We have more and more products offered to consumers. So in general, there are 2 groups of topicals that can be used particularly for the prevention of excessive scarring. That is, for one, the group of silicone gels and sheets, and for the other one, a group of topicals which are containing onion extract. These 2 groups have been well examined in different studies, and they're actually being recommended in the upcoming international guidelines for the treatment and prevention of excessive scarring. So for the consumer, I think it is kind of important that he might actually want to approach his operating doctor and ask the doctor for a recommendation, because normally the doctor might be aware of the changes and the updated studies that are being performed in the field.
But Dr. Gauglitz cautions that a complete avoidance of scarring is still a long way off.
We were actually pretty close in 2009. There was a big multi-center trial that was published using growth factor, a recombinant growth factor that was supposed to be injected directly prior to wounding and then 24 hours later. And the preliminary results of these studies demonstrated that the scarring was much more pleasant than when compared to placebo. However, beginning of last year, we actually could see that the big multi-center trial actually did not meet its primary and its secondary endpoint, meaning that the used growth factor was not sufficient in order to prevent unpleasant scarring. So I think we are now, or the field is now working on several different growth factors and proteins in order to have a very similar goal. However, I'm not sure if we're really going to manage to have significant improvement within the next 5 years, because the wound healing cascade is so complex that it's really not easy to target the central proteins in this complex cascade.
Stay well, be healthy, and I'll see you here next week for your dose of health news. Good night.